is a PowerPoint presentation for the nervous system and sense organs focused on chapters 8 and 9 of ICD-10-PCS. This presentation is a tool to be used in conjunction with the reading and the studying of chapters 8 and 9 and the doing of all of the assigned non-graded exercises for those chapters. A couple important points. First, you need to understand how an anatomy area or body region is classified, how it's grouped, how it's termed by the coding system, in this case ICD-10-PCS. The other two pieces are intention. We'll talk about in a moment. The intention of the procedure, the overall objective is important, that's tied to your root operation. And of course, overall, everything is based on your clinical documentation. For the most part, at this point, the clinical documentation is the operative report because we are coding surgical events. For chapter 8, in the cranial area and the nerves and the nervous system, the cranial nerves are classified as part of the central nervous system per ICD-10-PCS. For synaptic nerves, they're based on the muscles they serve. For ICD-10-PCS, that's how we group them, that's how we look at them from a coding standpoint. So it's important that you understand your particular body system you're coding and how ICD-10 views it. Surgical approaches is another area in your textbook chapter. The author gives you 4 surgical approaches that are commonly seen in the nervous system area. They are open, percutaneous endoscopic, and external. You can also refer back to chapter 1 of your textbook for the full definitions of all of the surgical approaches and some graphical pictures. I wanted to highlight for you the main difference between percutaneous and percutaneous endoscopic. Both have entry by puncture or minor incision. Both have using instrumentations. But the difference between percutaneous and percutaneous endoscopic is once the physician makes an incision or a puncture for the endoscopic piece, he then threads instruments through and then looks and uses visualization through those instruments to complete the operative event. The other surgical approach specifically mentioned in the chapter is external, and that is defined by ICD-10-PCS as procedures performed directly on the skin or mucous membrane and procedures performed indirectly by the application of external force through the skin or mucous membrane. As you're going through the chapters, you need to be paying attention to the anatomy alerts, the coding tips, and the guidelines that are specified. In chapter 8, guideline B3.14 is identified. That guideline has to do with freeing a body part. If the sole objective of the procedure is freeing a body part without cutting, the root operation is release. If the sole objective of the procedure is separating or transecting a body part, that is division. Again, these are guidelines. You need to be looking at these as helps, rules to help you as you're going through the clinical documentation. Again, also, the physicians are not required to use the terminology of the root operation. They can call a release whatever they would like to call it. Your role as a coder is taking the information in the clinical documentation and abstracting what's there and fitting it in or matching it to ICD-10-PCS guidelines, ICD-10-PCS definitions, and ICD-10-PCS rules. And guidelines are basically rules. Again, your clinical documentation is key. That's the first step. Then you try to match that up and analyze what's there. And the first piece of that for ICD-10-PCS is determine your root operation. In general, neuroplasties by definition are decompression of an intact nerve from scar tissue or other constraint. Therefore, that fits closely to the root operation release. Does that mean every neuroplasty is going to be released? I can't guarantee that. But in general, the type of objective, what's being done in a neuroplasty, would fall to release. I wanted to specifically highlight fluoroscopies for a moment. There is some confusion about fluoroscopies and surgical approach. A fluoroscopy is a procedure, or it can be a component of a surgical event. It is a radiology procedure. It is looking at internal structures without cutting. It is a tool. It does not require an incision. It is not a surgical approach in of itself. It is not tied to any surgical approach, such as endoscopy. Don't confuse oscopies and oscopies. All oscopies are not endoscopic. A fluoroscopy does not require a puncture nor an incision, and that is what's required for a procedure to be viewed surgically as a percutaneous endoscopic. It can be done with other procedures or alone. We often see fluoroscopy used in cardiac caths and lumbar punctures, IVPs, and certain biopsies. But it is not an automatic presumption that if a procedure has a fluoroscopy done during surgery, that means it's a percutaneous endoscopic or any other surgical approach. The fact that a fluoroscopy is done is just a tool that the surgeon is using to view the internal structures of the body. We can code it separately, and we will do that later in the course, but at this point in time, it's important that you understand that the use of a fluoroscopy does not mean any information is being given about surgical approach. In terms of grafting, specifically for the nerve area, but typically in general, grafting is done. That means there's two components. One is what we call harvesting, which is getting the good tissue, or the good nerve in this case, and moving that to the damaged area. From an ICD-10-PCS standpoint, the harvesting component would be considered excision for the most part. Again, you have to read the documentation. And then the putting of it on the damaged area would be considered supplement, because you're putting something there to help the functionality that's been damaged by whatever reason in that area. Again, the physician can call it a resection and it be an excision. That's a common word or common interchange of terminology, but it's how ICD-10-PCS views it per the documentation. If a physician is removing part of a nerve, of a good nerve, that would be an excision, not a resection. He would have to take the entire nervous system out in order for it to be a resection. Physicians are not required to document in the terms or meaning the same thing as ICD-10-PCS. The coder's role is to interpret information and make a decision based on what's provided in the documentation and the coding guidelines. That's for all coding systems, ICD-10-CM and CPT, and ICD-10-PCS. Chapter 9 is focused on the eye and the ear. You should have reviewed or will review the anatomy provided in the textbook chapter. You also should have as a reference a hard copy or an internet source for anatomy. The NIH website is a good, the National Institutes of Health, good online resource. You could also, of course, have an anatomy textbook. You can also have something called an atlas. An atlas is basically graphical plates, graphical pictures with some identification of the structures, but no narrative about functionality, no physiology component, just pictures of anatomy and telling you what they are and what their names are. For the eye, your textbook does mention the layers and the chambers and the cavities. It also talks about how eye muscles are classified in ICD-10-PCS. Also in Chapter 9, they talk about 3 specific root operations: alteration, extraction, and repair. Again, review the clinical documentation. When a patient has a procedure that is not medical, not for a medical reason, such as a facelift, a brow lift, it's for cosmetic purposes only. There's no physical reason. The patient has no burn. The extra tissue is not hurting their vision. If those aren't documented and the patient's having what we would call plastic surgery, the root operation is alteration. If a patient is having the diseased lens of their eye removed, for example, in a cataract surgery situation, but at that particular session, for whatever reason, based on clinical information, the physician is only taking out the diseased lens and is not putting in a prosthetic lens, the root operation would be extraction. It's extraction of a lens without replacement in that same surgical session. There is the expectation that at some point in the future, at another event, the physician will put an artificial lens in the patient's eye. If both are done, which is the more common way, we remove the lens of the eye, and at the same surgical session, we put in an artificial lens or prosthetic lens. Again, for cataract surgery, the number one reason is what happened. If that is all done at the same event, the physician knew when he walked in the OR that morning that he was going to remove a diseased lens of a patient's eye and put in a artificial one. That root operation is replacement. In general, corneal transplant procedures are coded to the root operation replacement. In general, radiokeratotomy procedures are coded to the root operation repair. And that's again based on the general intention, the general steps of the procedure, and you need to make sure you're reading the operative note and the body of the operative note, not just the tagline at the top of operation performed, that you're making your decision based on the clinical information provided in total, including the narrative of the operative report. For tympanostomies, I wanted you to highlight for you to ensure that you're paying attention to terminology. Your suffixes are important. We have ostomy and we have plasty. In general, the word or the suffix plasty, P-L-A-S-T-Y, means repair. A tympanoplasty is not a tympanostomy. They're two separate things. They both have to do with the ear. One is a repair, and one is looked at from an ICD-10 standpoint, for the most part, as drainage. A tympanostomy is when we put in laryngiotomy tubes in children's ears, for the most part, for drainage of chronic ear infections. Whereas a tympanoplasty is usually repairing of a ruptured tympanic membrane. Ostomy versus plasty. I hope you have found this brief presentation helpful. If you have questions on this presentation, please post in the related course forum. If you have questions on chapter 8 and 9, what's in the lecture, what's in the textbook, post to the lesson forum. And if you have questions on the textbook exercises, make sure you're coding the exercises and then looking at the answer key. If you have questions on your submitted work, such as an assignment or quiz, please email me. Please do not post those types of questions to the forum.